Station at Pearl Animal Hospital, and we're going to talk with our team about client service. So come on in.
Hi, I'm Cheryl with Pearl Animal Hospital. I'm the office manager, joined today by Brittany, one of our client care representatives, and we're going to talk about scheduling appointments. So when we schedule appointments, our typical protocol is that we do most appointments for a half an hour. For new clients, we always schedule full hours so that we have enough time to really delve into the client's history and go over the patient's previous records, their history, and answer any questions that the owner may have, as well as really go over preventative medications and wellness recommendations. It's very important to practice preventative medicine in our philosophy because that's a lot of what we do, and it's a lot of preventing future problems and future expenses down the line. When we do schedule appointments, we usually take our phone call schedule, or we'll schedule people that walk in the door, or we'll schedule clients as they're leaving for their next visit that they need a follow-up visit for, or maybe they want to schedule their future wellness visit out further in advance. When we do schedule, it's important for us to pull up the schedule, see what doctor they prefer to see, as well as keeping them with the same doctor that they've been seeing, especially for recheck appointments. It's important to have that consistency. Brittany's going to talk a little bit about the differences between our technician and our doctor visits.
So whenever I'm scheduling a new client, they're going to have to establish themselves with a doctor first. Like Cheryl had mentioned, all of our doctor's exams for new clients are 1 hour. If there are vaccines involved, we can oftentimes booster those vaccines with a technician appointment. Our technician appointments usually are within a half an hour or less. When deciding whether or not to schedule a patient as a doctor's appointment or a technician appointment, it really depends on if it's something that they're following up on or if it's a new concern. Any medical concerns, we do recommend a doctor's exam, and we do schedule that as a doctor's exam. Something like follow-up blood work, something such as booster vaccinations or simple nail trims can be seen as a technician exam.
Things like lab work and blood testing, a lot of times the technicians are the ones to answer those questions as far as, if the pet can eat beforehand, if they need to be fasting, if they need to have their medications beforehand. So the receptionist and myself will check with the technician, or we'll look in the chart note. A lot of times the chart notes will tell us what needs to be done for that appointment. On occasion, we'll get a question about double booking or having emergency appointments. What we do in that case is we do charge an emergency fee, which basically means that we're squeezing in the patient in between appointments that are already scheduled. We technically don't double book an appointment if we don't have to. That usually throws our day behind and can get us off schedule pretty quickly. So unless it's a true emergency or it's an urgent matter, then we will squeeze them in between appointments and work them in. But we always let the client know, because our client service is so important, to let them know that they are being squeezed in. There is a small additional fee to get them seen sooner, but we are happy to see